Before we get started, I just want, as most of you know, we implemented a new dashboard for our data yesterday afternoon. I did want to just give you a heads up. We're working just to make sure the data dashboard updates by a certain time each day. We've noticed today that our table view has updated before our chart view. So if you're following along with us today, please click on the table view on the website. We expect the chart view to update shortly, but just appreciate your patience as we adapt to this new system. I'm going to go ahead and let Dr. Josh Clayton give us an overview of today's cases, and then Secretary Kim Malcolm-Risden is also here to answer any questions you might have. I'll turn it over now to Dr. Clayton.
Good morning. As of today, we have 71 new cases of COVID-19 in the state. This does include 13 new hospitalizations that have been identified. We do have one new death that is being reported in a Minnehaha County resident. We have 115 new individuals who have recovered from COVID-19, as well as 420 new negative tests that have been performed. In total, that means that we have 1,754 COVID-19 cases in the state. 100 individuals have been hospitalized. We have 8 total deaths. There are 824 individuals who have recovered from COVID-19, and we have 11,061 negative tests that have been performed. For the community impact map, there are no new updates for today. I'll go ahead and give you a breakdown of our cases that have been being reported today. We have 1 case in Davison County, 4 in Lincoln, 65 in Minnehaha, 1 in Moody. The age range of cases, we have 1 in the 0 to 19 year age category, 13 in the 20 to 29 year age category, 19 in the 30 to 39 year age category, 15 in the 40 to 49 year age category, 9 in the 50 to 59 year age category, 9 in the 60 to 69 year age category, 3 in the 70 to 79 year age category, and 2 in the 80 year of age and older category. For breakdown of cases by sex, we have 21 males and 50 females. The total deaths that we are reporting as of today, we have 8 total deaths, and the counties where these deaths have occurred, we have 2 in Beadle, 1 in McCook, 4 in Minnehaha, 1 in Pennington, and for the age range of those deaths, we have 2 individuals in the 50 to 59 year age category, 3 individuals in the 60 to 69 year age category, 1 in the 70 to 79 year age category, and 2 in the 80 year and older category. In total, by sex, we have had 6 deaths among males and 2 deaths among females.
Thank you, Dr. Clayton. Now we'll unmute the lines and open up for questions. We'll take our first question.
Hi, this is Stephen Gross from the AP.
Go ahead, Stephen.
I'm wondering if you can confirm that the 1 new death was a Smithfield employee.
We do provide information about deaths that have occurred in the state. We do not provide information about which facility, if any, or where they were located, or any additional information like that. We do provide information on the specifics of the death.
Next question.
Megan Morat, News Center 1.
Go ahead, Megan.
I noticed that the number of pending cases is no longer listed on the website. Can you explain why?
So most of our cases, most of the testing that is being done results in very few pending cases. In fact, we have 0 cases that are pending as of today. It is rare when we have a pending case that is being held at the Department of Health and either being pending or retested. So, that's not information that we felt most people were interested in looking at this point. We're reporting out the positives and negatives.
All right.
Okay, and a follow-up question. I have a
go ahead,
follow-up question, if I may. Yesterday, the governor mentioned that the state's running low on supplies for those Abbott IDs and just overall testing processing. Can you speak to the current stock and when, if another round of equipment is set to arrive?
Megan, this is Kim Malson-Reisen. Excuse me. We have, from the beginning, really had to advocate hard to get the needed supplies, including, testing equipment. We feel like we're in good shape relative to equipment, but continuing to get swabs so that people can get their specimen collected, as well as transport medium so that those swabs can get to the lab to be tested. Continue to be things that we are working very, very hard to get. Back to the question around pending, we do not have tests pending because we have adequate supplies and feel like we will continue to have, adequate supplies, but we would like to obviously be able to offer tests more widely, and so we will need more supplies to be able to do that.
All right, next question.
Dr. Clayton, JP from KORN News Radio in Mitchell. Could you specify the sex of the case in Davison County and the age range, please?
So that is information that we do provide the cases by county, but to protect individuals' confidentiality, we do not provide specific information by age group or sex for cases by county.
Next
All right.
This is Joseph with the Capital Journal, please.
Go ahead, Joseph.
Thanks. Good morning, y'all. So I had a couple of questions, and I'm actually going to be concise. First time for everything. How many contact tracers do we have working now? I know last week y'all said it was like 80-something, but you said you were hiring more. And then next question is, how many different types of testing apparatus does the state have, between Avera and Monument and Sanford, with the rapid tests, and each hospital has a different one, and everybody buys from, which is part of the reason that supplies, like, there's no one person to get everything from. So how many different people do you guys have to go through to get that, those kinds of equipment? Sorry, I wasn't concise. Thank you.
So to your first question about contact tracers, so we do have, the individuals that you had mentioned before. So we have over 80 contact tracers. Given our lower case counts over the past couple of days, we have not had the need to bring on additional contact tracers, but we do have both our training plan and our staffing plan set up so that if we do need to bring on additional staff, we can do so in short order. As far as the testing apparatus and other sort of capabilities, we continue to look at, what is available out there as far as different platforms to meet the various needs. That would either be the molecular testing to identify COVID-19 virus in clinical specimens, as well as looking at what are the needs for any antibody testing, as that is starting to come online now. And I cannot speak to specifics around, who is using what different testing equipment. I just know that that is a rapidly evolving area with different manufacturers coming online, and depending on the products, facilities, including hospitals, potentially, switching to different reagents or, different testing kits from those different manufacturers.
This is Morgan at the Rapid City Journal. I have two quick questions.
Go ahead, Morgan.
Can you give an update of Smithfield cases today?
So for Smithfield, we have 761 COVID-19 positive cases among Smithfield employees.
And do you have like close contacts for them too?
So the individuals that have been close contacts that became cases are still sitting around 143.
Okay, and then my second question is if the Department of Health is any closer to releasing data about race and ethnicity of COVID cases?
Morgan, this is Derek Haskins. As you know, we launched our new data dashboard yesterday afternoon, continue to work on that system, and that is next on our list to add to that data dashboard, and hoping to do that in a period of days.
Okay, thank you.
Next question.
This is Stephen Gross from AP.
Go ahead, Stephen.
So I just had a question. Dr. Clay, you said that there were 71 new cases today, and then on the portal on the website, it's showing a 70 increase from yesterday. So I just wanted to clear up the discrepancy, or what's the right number to go with for today?
Yeah, that's a good question. We do get that fairly often. I think it's important to recognize that these numbers are provisional, and that we're providing the most current case count on the website, and that is sometimes updating to account for changes in individual county of residence, sometimes individuals who have been tested in the state, who in South Dakota that are actually out-of-state residents. So the numbers do fluctuate based on our investigations, and we're spending time doing the investigations rather than tracking down individual cases that might move around in different parts.
Okay.
So the total positive cases is at 1,755, and that's a 71 increase or a 70 increase?
So we have 71 new cases that are being reported today. So the change is that one of the other cases is no longer located in South Dakota, that information has been updated to their actual location of residence, or state of residence, I should say.
All right, next question.
Can you identify the new death, what county, or rather the age range and gender, please?
Again, I can provide the county of residence of the decedent. That is an individual from Minnehaha County, is the new death. Other information, we do not specifically provide by age group or sex.
One final question.
Donald Trump suggested that the data suggests that we're past the peak of new cases. Where is he getting that data from? Is that what the data says now?
Well, I think it's important to recognize that, discussions that are had at the national level are focused, on what's happening overall nationally and not specific to South Dakota. What we have been seeing in the last 2 days with a little bit lower case counts for our new COVID-19 cases, does not mean that we are past our peak that's anticipated. What it means is that we are doing a good job both on the side of testing individuals who have COVID-19 to identify those cases that from the public health perspective that we're working to contain those new cases and asking people to isolate at home and doing the close contact follow-up of those individuals, and that individuals are then themselves taking on precautions to minimize their risk of transmitting COVID-19 if they're positive, or from potentially being infected, so that social mitigation or community mitigation side of things. So I would say that we are still anticipating our peak the second week of June, but are happy to see lower case numbers of the past couple of days.
All right, thank you all for joining us this morning, and we will talk to you again tomorrow.